So in terms of the format for today's session, we'll have a 20-minute presentation from our guest speakers, but then there'll be an opportunity for people to ask questions. So we'll have the opportunity of people asking questions via Skype messaging, but also being able to ask in person. But let's get into the presentation. So I'm going to hand you over to Ruth and Maddy to take us through our initial slide deck. So over to you, Ruth.
Thank you, Jamie. Hello, I'm Ruth, and as Jamie just said, Maddy and I will outline the September 2018 Heart Age campaign and the opportunities for partners to use it to meet your local priorities. Everything mentioned today will be made available for free on the Public Health England Campaign Resource Centre website. Next slide, please. So tackling the risk factors that lead to cardiovascular disease is a shared local and national priority. As many as 7 million people in the UK are living with undiagnosed high blood pressure without knowing they are at risk, and the only way to know whether you have high blood pressure or not is to have it measured. The marketing response to the challenges set by CVD is to alert and inform the public, to ensure people know what they need to do in order to live healthy lives and are motivated to do so. The Heart Age test is part of that solution. It is a digital tool that offers partners an opportunity to deliver prevention at scale. It is designed to be used across the NHS, local authorities, and sustainable transformation partnerships and integrated care systems as part of prevention strategies. It reaches into people's lives and nudges them into taking their heart health seriously. Next slide, please. Launched in 2017, the Heart Age test is a free online test that asks people for physical and lifestyle related information, as well as their blood pressure and cholesterol numbers, to determine if their heart health is at a higher age than their actual age. It then goes on to offer lifestyle advice on how small changes can make a significant difference. And it explains what blood pressure is, why it is important, etc. Heart Age sits under the 1U brand, a nationwide programme which supports adults in making simple changes that can have a huge influence on their health. 1U has been adopted by local authorities up and down the country as their healthy lifestyle brand, providing one voice locally, regionally and nationally. The test has proved to be incredibly engaging, being completed over 1.8 million times since launch, with thousands more taking the test each week. This is a great example of prevention at scale. And new for 2018, and responding to demand, we are delighted to tell you that partners will be able to embed the tool onto any website using an embeddable link code. So I'll now pass over to Maddy, the campaign lead, to tell you more about the 2018 plans.
Thank you, Ruth. Next slide, please. Hello, everyone. And thank you, Jamie, as well, for sharing. So this year, we are once again investing in the Heart Age campaign with an aim to increase the understanding of the importance of knowing your heart age and blood pressure through ensuring that as many adults in England complete the test and, as a secondary ambition, have their blood pressure checked. This year, our focus is very much on our partners with the intention of supporting you to tackle CVD through a focus on prevention. Next slide, please. So this slide provides an overview of how we frame our national campaigns in the marketing department and how partnerships in particular fit into this. As you can see, partnerships run through all 4 pillars. First and foremost, to alerting the public to the problem, then motivating them to take the test, supporting them in doing so by signposting to the test and to blood pressure checking stations, and then of course in sustaining momentum. Heart Age is actually what we call an always-on tool. So if September doesn't quite fit with your existing activity calendars, you can use the resources to activate it locally at any point in the year. Having said this, ideally all activity would run together to make the biggest possible impact across the country. Next slide, please. So in terms of the customer journey with the Heart Age test, there are many routes to the test, including the main 1U website. But during the campaign period, the channels that we're using include PR, public relations, paid online, including search and Facebook, as well as ECRM and the 1U channels. So for 1U, we've got a website and social media platforms, Facebook and Twitter. This year, as Ruth mentioned, if you embed the test onto your website, you can then signpost to your own site rather than the 1U site, as well as to local face-to-face events and blood pressure check stations. Obviously, this has the benefit of keeping users on your site, so we're really pushing that kind of embeddable link this year. Once the test has been completed, the user will then be signposted out to other 1U apps and tools, as well as to places like the British Heart Foundation and NHS Choices, including the NHS Health Check, which is designed to spot the early signs of conditions such as stroke and heart disease. You can find out about local blood pressure events in your area by visiting the Stroke Association and Blood Pressure UK's websites. Both these charities are running events in September. Also, pharmacies such as Lloyds and Well will be offering free blood pressure checks, but I'll come on to that a bit more in detail shortly. Next slide, please. Just moving on to partnerships. Next slide. So partners play a crucial role in reaching more of our target audience in places that are convenient and relevant to them. This slide just shows a selection of organisations we are in discussion with for this campaign. Pharmacies will play a central role for HeartAge, with many, although not all, providing free blood pressure checks. The pharmacists will also be signposted in our literature as a destination for the public to seek out further information and support, and this will be alongside visiting their GP as well. Retail partnerships are being developed with several major commercial organisations, including Omron, who you've probably never heard of, and they produce the home blood pressure testing kits, as well as Argos, which sells the kits. Many of these organisations we actually worked with last year, so we've got really good relationships with them. Ensuring that we are aligned with key charities means that the campaign is very much supported by charities that operate in the CVD sphere. The test was actually originally developed in partnership with the British Heart Foundation, and they have a bespoke version of the test on its website. The Stroke Association will be distributing HeartAge materials at local blood pressure events in September, whilst Blood Pressure UK is making a concerted push on blood pressure awareness during their trademarked Know Your Numbers Week, the second week of September, which we do actively support. And I know that many of you will be upweighting activity in your area during this week as well. During the Know Your Numbers Week, there will be I think they're running about over 100 blood pressure events around the country. And as previously mentioned, do check for events in your area. Finally, public sector bodies and local authorities sit at the heart of everything we do and are fundamental in upweighting the campaign across regions. So more on this later. Next slide, please. So I just wanted to give you a bit of background, a bit more info on some key partnerships. So I've put two in here. The first one is our partnerships with Lloyds Pharmacy. They will be providing free blood pressure checks across their 1,300 pharmacies in England. They will also be supporting HeartAge messaging across their digital channels and through Lloyd's All About You magazine. So it's a really good partnership that we're running with them. Next slide. And then another example partnership is with Slimming World, which works closely with us across actually many of our campaigns. We've got a really good relationship with them. They are really keen to distribute literature to their 1 million members via their 4,000 consultants across England and via their own platforms. Slimming World has also mentioned producing regional toolkits to include case studies from local areas, as well as local offers. And now we're just waiting for further information on this, and we're still working through what this partnership is going to look like. So when that does happen, we will cascade that information out to you. Next slide, please. I'm just going to hand back to Ruth.
Thank you, Maddy. So this picture was really just to show how valued our local authority and NHS partners are. You are the cornerstone of the 1U, and how the campaigns fit best for your residents and patients can only be decided by you at local level. But having the same message locally and nationally is where the synergy and scale can really make a difference in breaking through all the noise. Prevention is being taken more and more seriously by our sustainable transformation partnerships and our integrated care systems. So it's as important as ever to remember that residents and patients don't think in terms of these boundaries or footprints, and that it's our job to reach into people's lives with clear, consistent messages and offers for solutions. Next slide, please. So what are the opportunities for you? Well, depending on the level of investment you'd like to make, there's lots of ways to get involved. As previously mentioned, the easiest way to support the campaign is to embed the test onto your healthy lifestyle website, GP website, etc. But you can also display the resources, posters, leaflets and blood pressure cards. And again, you can tailor them to fit with your healthy lifestyle service or your local logo or brand. And you might also want to run your own blood pressure events, offering free testing in your area. And of course, you can support the campaign messaging across your digital channels, such as social media channels, intranet and blogs, and not forgetting your internal workforce. If you do have a larger budget, you can invest in out-of-home advertising. Alternatively, on a smaller budget, online spend is a really good option. And we will once again have the ever popular PR toolkit, which you can use to issue local news stories with local case studies. And next slide, please. And just before I hand back to Maddy, this slide is just a couple of examples of activation from across the country, which are open to you all. So just a big thank you to Cumbria, who upweighted it in their sports centres, Luton, who ran a multi-channel campaign, and Crediton, who ran it through their pharmacies. Over to you, Maddy.
Thank you. Next slide. So just to touch on our PR and comms plan, on the day of launch, we've actually secured Dr. Hilary Jones, the TV doctor, and we're going to take him on tour. We're actually calling it On the Beat for the day, taking people's blood pressures and getting them to take the heart age test to reveal their heart age. He'll be commenting on a national news story that we will issue under embargo prior to launch day to hit news outlets on the 4th of September, which is our launch day. And we'll have healthcare professionals and case studies he'll be used to promote the messaging. There will be a PR and comms toolkit, as Ruth said, available for comms leads to adapt. And this will include our key messaging and an overview of the Doctor on the Beat activity. You may have resource locally if this is something that you could run yourself across the regions. You might have an access to a local talent, for example. So we'll include information on how you can replicate that regionally. There will also be spokespeople from PHE and the NHS, of course, and Jamie Waterall, who's on this call. Next slide, please. So going on to our paid media activity. So the campaign will also be amplified across Facebook and the search engines Google and Bing. We'll be investing in these channels throughout September with posts, GIFs and carousel format adverts, focusing on the campaign narrative as well as specific moments across the month, including Know Your Numbers Week, led by Blood Pressure UK, and World Heart Day as well towards the end of the month. There will be a digital toolkit available in August, which will include digital assets for those that want to promote the campaign online. Next slide, please. I also wanted to include a bit of information for those that might have budget to run their own media campaign but aren't sure how to go about it. We've had a couple of queries over the last few weeks around this, so I've just put this slide in. This just gives a brief overview of the considerations you might want to think about. Things like what's your objective and what kind of budget do you have. These will both inform whether investment goes into areas like digital, TV or out of home. Considering how it fits in with the national plan is also really encouraged, and we ask you to communicate your plan to us so that we can support and align messaging rather than compete against each other, and that's quite important. So in the box there's actually an example which I won't go through, but if it is of interest, have a read through and give us a call or an email with any questions or if you want to talk it through. Next slide, please. So just moving on to the toolkits that we've got available. So we've mentioned these quite a lot and all the resources that we're creating. So there will be a campaign toolkit that comprises resources that can be ordered and posted to you. And this includes A4 posters, an A5 leaflet, which is actually a 4-page booklet, and a Know Your Heart Age card to record blood pressure readings. So they're perfect for pharmacies or anyone holding a blood pressure testing event. And these are credit card sized cards, so they easily fit into a wallet. The resources will be bundled so that pharmacies and local authorities can order packs instead. So if you're a pharmacy, you just might want to order one pharmacy pack and it will have everything in there that you need. The campaign toolkit will also detail the digital resources available to be used across a partner's comms channels, including copy as well as images. And then, as Ruth said before, a PR and comms toolkit will include messaging, press releases, long and short copy, social posts, etc. Next slide, please. Now, I'm hoping that all of you are familiar with our Campaign Resource Centre, but if not, all of this information and all of our campaigns actually across the whole marketing PHE suite, they all sit on our Campaign Resource Centre. So the resources will be available to pre-order today. I've actually uploaded a pre-order form, so if you are really excited about this and you want to place an order straight away, please do go onto our Campaign Resource Centre, register your details and place your pre-order. And they should be, I'm hoping they'll be available to post out to you mid-August. Our timelines are, can be quite long with printing and posting. Now, we will have digital assets as well that you can just download yourself and adapt, but they won't be available until mid-August as well. And we hopefully want you to use them all at the same time, so to be used kind of in September. But I know some of you need them sooner rather than later. So if you do need things as soon as possible, get in contact with us through our partnerships email. Next slide, please. This is this PHE marketing portal. This is kind of the portal for all resources, including toolkits, images, case studies, etc. So what we've actually included on the CRC is a lot of how-to guides, which I'm not sure how readily they are used, but I really wanted to draw attention to it in this webinar. We've got a lot on there, things like how to launch out-of-home advertising, how to measure and evaluate your campaign. So please do go onto the CRC and have a look to see what's on there that's helpful for you to use. Next slide, please. So once you've decided on ways you would like to support the campaign, let us know. We'd love to hear from you. We want to know what our partners are doing, and it's really beneficial to have the information so that we can connect the dots nationally. It may be that we can connect you to a commercial partner, share best practice, or provide further info or ideas to complement existing plans. When it comes to evaluating the national campaigns, we also need visuals and pictures. They're really important to us so that we can showcase what's happened across the regions. And then if you are evaluating your campaign, any data and statistics you manage to collate, share those as well. It's really invaluable stuff for us. We really like to show the amazing work going on across the country and the impact that the campaign has. It also helps to inform future campaigns and investment levels. So yeah, do get in touch and stay in touch. Next slide. So next steps. The webinar will be available to share and listen to again shortly, next week, I think, and the link will be sent out. And there is now a 2-page briefing sheet on the Campaign Resource Centre that includes our materials. So please download and forward at will once you've signed up to the Campaign Resource Centre. There's also the pre-order form that I mentioned before, and you can order those now. Next slide, please. And then in the appendix, we've just included a campaign timeline, just so you're clear on the timings for the campaign. Tuesday, the 4th of September is our day of launch, with PR spiking in the first week, paid media running through September, and obviously our partnerships hopefully upweighting through September and beyond if that's something that you want to do. And as I mentioned before, Heart Age is an always on campaign, so you can run it at any point. Thank you for listening to us talking about Heart Age. Next slide, please. Here, I've just included, just going back to the previous slide, sorry. email addresses for our 4 regional marketing managers on this slide. So Ruth, who's presenting today, operates in the south. We've got Alana in the Midlands and east of England, Alex in the north, and Dan Ward in London. So you can get in touch with your regional marketing manager, and do get in touch with them. And for general inquiries, contact the partnerships team. We always respond to emails as soon as possible, and always within 3 days. It's partnerships@phe.gov.uk. And the Campaign Resource Centre link is on there as well. So I'm going to hand back to Ruth now, who's going to briefly take you through Stoptober, the Stoptober campaign, before we have some questions.
Thank you. Next slide, please. So I'll just briefly touch on the annual smoking cessation campaign, Stoptober. It's launching 2 weeks after Heartage in September, and I just have 4 slides to briefly remind you of what's happening, but just to say we still are in planning stage, so bear with us. We just thought you would really appreciate a heads up as early as possible. So the evaluation of the 2017 campaign has led to 3 insights about smokers' approach to quitting. They're the top row on the slide. 1, smokers are making unassisted quit attempts, which are less likely to be successful, aka cold turkey. 2, there's an increased apathy to quit. And 3, lower confidence that they'll be able to quit. So if you look at the slide, there's 3 bespoke solutions there, but they're all united by a simplified message, which will just be pushing smokers toward, helping smokers navigate the stop smoking landscape and pushing them towards existing tools. Next slide, please. But much like Heartage, new for 2018, we will have a new web tool. It doesn't yet have a name. It's been created based on input from the Fagastron test for nicotine dependence, as well as the previous PHE triaging tools. So this tool, once again, will be able to be embedded on your websites. And you will see on the screen there's a snapshot of 3 simple questions that will be asked. These will be asked to determine the level of dependence, and then smokers will be showcased suitable quit tools. So when we say we're going to be pushing a simplified message, we really want to help smokers navigate the variety of options that are out there to stop them going cold turkey or stop them going on their own. Just to reassure you that face-to-face support will always be highlighted on the results page, with a postcode lookup to local stop smoking services also. And it's worth noting that the triage tool has been designed as a guide, not to replace professional advice. It's also been designed so that it isn't too intrusive, asking the user for minimal information to keep them engaged. Next slide, please. So in the spring, we asked you to answer a survey about your plans for Stoptober and which resources you would find most useful. Based on the feedback, we are developing the assets outlined in this slide for partners to use. So they should be all relatively familiar to you. But in addition to the promotional materials, we'll also be sharing an overview of information which will be available to healthcare professionals on e-cigarettes. And this will be shared in August, so you have consumer resources and health professional resources. Next slide, please. So just to finish on the timing and next steps. As always, we'd love to hear about your Stoptober plans, so please get in touch. It's never too early. In August, local authority and NHS partners will be able to pre-order printed resources, and the full suite of resources will be available in September, again via the campaign resource website. We also do have a 1-page brief that will be available after the webinar. And if you do have any questions, again, please do contact your regional marketing manager or the partnerships email. And I think that brings us to the end of the webinar.
Excellent. Maddy, Ruth, thank you. That's really clear, concise presentation, and it's fabulous that actually participants have been able to hear both about the Heartage test campaign, but also the early plans for Stoptober. So there's a great opportunity to hear about those. What we're going to do now is we'll move on to questions. I'm going to start with colleagues that can